Good afternoon. Okay, let me take control. Okay. Good afternoon, everyone. My name is See-Kiong. Thanks for the introduction and thanks for the kind invitation for me to give, I think, rather interesting talk, I suppose, very relevant to us at this moment, whether AI can rescue us from COVID-19, or if not, maybe in future pandemics. This talk really is not about my work, but more about what I was thinking about to try to answer this question, which I think most of us have. But before that, let me show a picture, if I can. Let me see. Okay, so if you look at this picture, you would think that this is something people are queuing up to see a rock star, some movie star or something, some rock concert. As a researcher, this never happened to me in my life, or I would dream of it, but it did happen. So this was actually the NIPS, or the NeurIPS conference, which is about deep learning, the leading deep learning conference in 2018, and this is, I think, in Montreal. So in 2018, actually, the conference was sold out. The tickets to the conference were sold out in less than 12 minutes. Okay, that's in 2018. Actually, in 2017, the tickets sold out in 2 weeks. Okay, so in 2018, it becomes so popular by 1,000 times. So the tickets ran out in 11 minutes. And last year, you actually have to win a lottery in order to get into the conference. You can't buy the ticket. The ticket is you can get a ticket by lottery. So by luck, you can get one. So it shows that there is this tremendous interest in AI by everyone, beyond just researchers. If you look at people who queue up here, quite a lot of them are from the industry. So certainly, we are now in the age of AI. Everybody is interested and everybody is looking to AI to save us from COVID-19. So maybe we turn back the clock a little bit just to put ourselves in perspective. Maybe quite a while back, I think one of the big achievements in 1997 was when AI first beat the human expert at chess, right? In 1997, this was IBM's Blue Gene, right? So that was one of the biggest surprise. But people still didn't start queuing up at NeurIPS, okay? Only recently it started, and that's because two more, after many years, two more achievements. So one would be in 2011, where IBM's Watson beat the human experts in the game Jeopardy. Now, this is quite significant in terms of AI, right? Because in the previous one, chess game was kind of like a mechanical game. It's nothing very intelligent in most perspective, right? Whereas in this case, the game was conducted in natural language. The computer was able to understand human languages and then ask intelligent questions and to win the game. So this is really a very big demonstration of what most people would think as AI, right? Because AI is really about computer being able to do human cognitive tasks very well. So speech and asking questions, understanding language is very a more impressive AI achievement. Subsequently, another game, okay, which is Go. In 2016, the AlphaGo beat the human Go expert. And Go is a game, but however, Go was supposed to be the so-called the gold standard, because the search space is just infinite. It's impossible to win by brute force. So you need to have some kind of intelligence in your gameplay in order to beat it. So again, this was another big breakthrough, and then people start queuing up at academic conferences that previously only the professors and PhD students will attend, but now everybody is queuing up at the conferences to understand what is the latest development in AI. So really, so we have come a long way, and now really AI is in the public limelight. But another key achievement in AI, again in cognition, is about visual cognition. So AI also beats human in visual cognition. So this is the ImageNet data set made available by the Stanford group. I think it has maybe 15 million pictures with labels that people say, okay, this is a picture of cat, this is a picture of chair. So every kind of object, there are hundreds and thousands of examples. This is important to note, because AI, the intelligence come at a price, which is at the price of data. You must have enough data for the computer to look at, enough examples. So the annotated data is very important for supervised learning. So ImageNet make available these big data sets of image, okay, with labels and of many different types, and it has been a challenge for the AI researchers or the computer vision researchers to try to create computer that can recognize the images much better than human. So a long time ago in 2010, 2011, okay, these are still using the traditional computer vision techniques, okay. Traditional computer vision techniques means you have human crafted feature, okay, like edges, lines, and circles and whatever as features to describe the image, and then you try to view a classifier to recognize the image of cats from dogs, or chairs from tables, and so on and so forth. Now, starting from 2012 comes this breakthrough on deep learning, right? Deep learning, basically deep learning, by increasing the levels of the neural net, okay, the computer is now able to learn the features too. So you don't need to tell the computer to look out for lines, look out for curves, look out for like circles or whatever in order to describe an image. You just need to feed the computer just pixels, right? Pixels, just a raw image, and then the computer is able to figure out what are important features in the pictures in order to recognize the image. So, but it also takes some time in the beginning. So what is shown here on the y-axis is the error rate. So of course, the lower the better. Okay. So the human benchmark is here. Humans also can make mistakes because some images are very hard to recognize. So it took some time. Okay, a few years. Where in 2015, the ResNet by Microsoft was able to beat the human, and then of course after that the computer gets smarter and smarter in recognizing image. Okay, so now we start to see application of computer vision or visual cognition, right, by deep learning networks. So here is one example. I think you probably have a lot of these in Thailand and in everywhere in the world, but here is one that in my office. Okay, in 2018 we use a face recognition. In fact, I never bring my card or my key now to enter the office. The office recognizes my face, and then you will open the door if the right person is here. And sometimes now some companies use that to recognize you, to pay, to unlock your credit card to pay money. So because the algorithm is very accurate now. Okay, so here is one example of AI being used. But AI, the power of artificial intelligence is that it can also scale up a lot, because once you can recognize one face, you can also recognize millions of faces if you have the data. So so that can lead to problem. So when AI beats human in visual cognition, so now it can recognize everybody's faces. It can see you everywhere because there are cameras everywhere. Uh, it can help track you. Maybe in times of pandemic is useful, but let's say in usual normal time, you may not want to be tracked so often. But then the technology is there, and because it's computer is cheap, and computer is everywhere, you have issues like privacy, right? As opposed to convenience. So that's one problem. Okay, but it can the same thing. You can use it for for um, for good causes such as medical cases. So so um, so like AI can recognize photograph of cats better than dogs, but that's not very useful. But if AI can recognize X-ray images of patients who has pneumonia as compared to patient who didn't have that or various seriousness, then it's very helpful, right? So in 2017, here's one example of the computer being able to perform as well, or if not better than some of the human radiologists in identifying X-ray, chest X-ray images that has a pneumonia for diagnosis. Okay, so or other kind of medical images. So here's another one that's not inside our body but outside our body. So this is about skin cancer. So you can take picture of this so-called epidermal lesions. You can identify what are benign ones and malignant ones, right? So here again, the AI algorithms, the image recognition or the computer vision algorithms built again by deep neural networks are able to do as well as expert dermatologists, if not better, again in recognizing benign lesion from malignant, right, for diagnosis. Or it can also look into your eye. This is a work, although that my group is also actively researching on. So by looking into the retina and the vessels, you can tell a lot about the health of the person, especially for example for so-called complication of diabetic patients. This has been shown to be very useful. In fact, the technology has been lately has been so-called accepted by the American FDA for marketing. So you can now claim that your AI software can detect diabetic retinopathy, or actually there are quite a number of other AI technology that are being accepted by FDA to help diagnose various diseases. So with all these achievements, the natural question to ask will be, can AI come to help us when we need it to help us, right? Can it come and rescue us from COVID-19 and future pandemics? Um, so so let me talk. I thought about this problem for a bit, and I also look at the literature. Right. In fact, interestingly there are quite a lot of literature about AI being applied to COVID-19. So generally, there are three aspects where AI can play a part in COVID-19 and other pandemic mitigation. Okay. So one level is it can help in the clinical settings. The second part will be it can help look into the biological setting in the molecular aspect, and thirdly in the societal settings. Okay, so I'll talk about these three aspects where AI can help us in managing COVID-19 and other pandemics. So in clinical case, from a clinical perspective, here are some examples on how AI can help. So one, we have looked at how AI has been helping us in medical imaging. So clearly, AI can help us in diagnosis COVID-19 using medical images. The other is AI. Perhaps AI can also help in mining the electronic health records of the COVID-19 patients and help us in the prognosis, not just diagnosis, but prognosis in predicting patient outcomes. Thirdly, from a public health perspective, AI can help track and maybe simulate or predict disease spread using non-invasive devices. Um, in my group, we are looking at check-in, check-out data, such as Wi-Fi data, to kind of model the human mobility, the actual mobility, and use that mobility information to better track or simulate disease spread, and also come up with strategy like immunization or selective screening based on the mobility patterns. Um, so from the biological perspective, AI can help by looking very deeply into the molecular structure of the virus-related proteins. Okay, I'll talk a bit more on this later. This comes from my previous life in bioinformatics. Then, if you know the structure and you can use it to help identify the targets for drugs and vaccine. Then once you know the targets, you can also help using AI to identify maybe existing drug for repurposing to target the COVID protein, the COVID virus, or to help design new drug compounds. And finally, from biological research perspective, there are a lot of information being published in the biomedical research articles. And AI with natural language processing can help to scan and summarize the large bodies of literature to help speed up the discovery of the understanding of the COVID virus, as well as the drug and vaccine research. And thirdly, from the society perspective, how AI can help? Well, AI can help to monitor big data in the society for early warnings of pandemics. It can also help us in enforcing the preventive measures in a society, and also help perhaps better engage citizens with, let's say, the AI technology such as chatbots. Thirdly, it can help. We should use AI to help investigate the propagation of misinformation and disinformation that can create problem or unnecessary worry in the society. And finally, also help us understand the social emotion on various aspects of the pandemic that are so-called expressed that we can mine from the social media. So these are the three aspects that AI can contribute in help managing the current situation in COVID-19. So in the next part of the following part of the talk, I will talk a little bit. I'll give some examples on some of these applications. Okay, so here first let's talk about the clinical application of AI. AI can help from diagnosis to prognosis or outcome prediction. So here's one example: AI analysis of medical images for diagnosis. Here is a paper on by the Shanghai group on looking at the CT images with deep learning. Okay, so Shanghai researchers have devised a system, an AI system that that help the human to check the results by reducing the analysis time of the CT image from hours down to 4 minutes. So how do they do that? So the CT scan of the chest images can start by the human trying to do the segmentation or delineation, and then this manual example can fit into the computer to learn. Right, the computer can start learn from the doctors how they segment and delineate the images, and then use and learning from these examples create an algorithms to help automatically segment the images and then the human being, the doctor, can continue to correct it and then improve on the AI system. So here, this is how a typical so-called AI system works. So you need to have data that the computer can learn from, and then ideally, you also want to have human beings to correct the errors that the AI may make, and then use it to continuously improve on the AI. So this is the system that they have implemented, what we call, I think, human in the loop. Also, what Professor Sawaraki was talking about previously. So with this system, the Shanghai team can now use the system to screen many people in a rapid fashion and then help them track, let's say, for example, this patient, track in detail how the disease developed at different stages of the time, and then help the doctor diagnose and then treat the patient more effectively and more timely fashion. So this was an example of diagnosis. I give you another example of prognosis or prediction. So in this case, it's not about the images, but more about the medical records, okay, the data of the treatment being given to the patient and also the outcome. So here's another work published by the Wuhan group about predicting the criticality of patients with the COVID-19 using three clinical machine learning, three clinical features based on a machine learning method. Okay, so they looked at 3,000 patients records in Wuhan, and then built an algorithm that can predict the rate of mortality, the death rate for patients with more than 90% accuracy. So by learning from the medical records, they found three important so-called clinical markers that they can separate out the patient who can survive, the dark color ones, patient who can survive, versus the patient who could not survive. By looking at these three clinical parameters, you can see by plotting them out in this 3D space, the two groups of patients can be separated out with a decision boundary here, okay, with a 90% accuracy, because it is quite well separated based on the data. So in fact, they built a decision tree based on the three parameters, and then can predict the survival or death rate with an F1 score of 90%, which is quite impressive. Okay, so here it's about how AI can use to mine the electronic health records to help prognosis, predict the patients who needs more help. So I guess the way you use it will be people who are likely to survive versus people who are likely to get more serious. You might want to take care of those who are likely to be more serious to help them survive, or if you have limited resources, maybe use that for decision making. So these are two examples for at the hospital case. I think it's quite obvious, but I think the other key part that AI can play a big role in is about treatment, about the biological or biomedical aspect of it. And this is about the bioinformatics work, which actually has been long going work since the 1990s, the Human Genome Project. But in particular for this kind of setting, it is very important because one of the first data that are available was the genome sequence of the COVID-19. And then from the sequence, what we want to do is to see if we can help predict the 3D structure of the proteins. Okay, the genome sequence is a blueprint of the DNA of the COVID-19 virus. It will tell us what are the proteins that it creates, right? Then from the protein, because it's a genome sequence, so it's still a 2D, but protein, if for some of you who understand biology, is a 3D structure. The shape of the protein is very important. But then from 2D to 3D, if you want to experimentally determine the protein structure, is very costly and take a lot of time, take months. But if you can run a program to predict how the protein will fall from the DNA sequence, it will be very useful. So here, the scientists have put into to place some prediction of the protein folding. In fact, I think this is a group by the I think the group by the one who won the gold. Okay, the DeepMind group used their DeepMind engine to help predict the various structure of the proteins, the different proteins that are generated by the COVID virus. Okay, so by knowing the 3D structure, it will be very useful to know what are the so-called the exposed area, and this is what we will call the target. How you want to target the you use a small molecule to target the COVID protein, and then perhaps even eventually to kill the protein. So target identification will be benefited by knowing the structures that are predicted by AI algorithms from the DNA sequence of the virus. Okay. Now, so here's one example. If once you know the structure, you have a molecules, you can see how it might dock into the 3D structures and use it for treatment. So one strategy will be to look at the potential highly potent drugs. Okay, given all these structures, maybe for existing drug, okay, that we can use it to reposition. You hear about a few examples now. I think in the news that some of the drugs that are used for treating other diseases was found to be useful also for treating the COVID. So here's how you might try to predict or find some of those current drugs that can be reused for curing the COVID-19 or treating COVID-19 patients. So you basically look at the drug, the small molecules. Again, you know the structures, and then since you know the 3D structures of the protein, you can see how some of these drugs may fit into the 3D spaces of the proteins and thereby blocking the proteins of the virus. Okay, so here's how you might work. So that's AI screening for drugs. You can do it very quickly given the current databases of drug molecules and also the predicted or experimentally determined 3D structures of the COVID-19 virus. Okay. So how about society? So AI can be used for epidemiology, right? For tracking early warning alerts. We heard example actually for COVID. On December 30, Blue Dot is actually an AI company that uses AI to track big data, big data of society, such as people search logs and also other news articles of the world, and they were one of the first to alert that a cluster of unusual pneumonia cases happening in the market of Wuhan, so in December 30th, right? Yeah. So, and actually there are a few other AI programs that also have alerted that. So the Blue Dot algorithm, in this case, they are able to scan foreign languages, news reports, and also airline ticketing data to predict the spread of the diseases. So here's one example on how you might want to track big data, big society data, social data for early warning alerts for pandemics. So the other use of AI will be to help forecast the disease spreads. So we can use the AI latest techniques such as deep learning to find accurate early forecasting model from the data set. In this case, it's small data because in the pandemic case, you usually start and hopefully you continue to have very small data set. In this case, what they did was they use a polynomial neural network, okay, But in order to address the small data for the prediction or spread, they have the feedback, right? They have this feedback that feed into the nodes, and then they use it to correct for the prediction, and compared to the traditional methods such as ARIMA and other modeling approaches, they show that this method can actually be more accurate in predicting, forecasting the disease spread than the traditional method. AI can also be used for enforcing the preventive measures in the pandemic case for social distancing. So here's one example in the States using computer vision. So computer vision, you can recognize the people. So this is actually in Amazon's factory. So you can track the people very well using AI algorithms. Since you can track them, now you can also build a radius of the safe distancing, and then if the safe distancing is not being observed or being violated, you can very quickly and automatically detect it. Back home in Singapore, we also experimented using the robot dogs in open space to also try to detect social distancing violation or advise people to maintain their social distancing. The other use of AI will be in the temperature screening to detect people with fever using, again, the computer vision methods to detect from the temperature screening. So again, the good thing about using AI is that you can deploy it now on cheap equipment, and then you can deploy in a massive scale. You can scale it up very quickly. Okay, but I think more interestingly, in the new age, right, new information age, it's not just epidemiology, the physical disease spread we need to manage. There's also what you call, or what the WHO call, the infodemiology, right? In fact, it said that we are not just fighting an epidemic, we also are fighting an infodemic, because there are a lot, the information spread very fast, but misinformation and rumors are bad for controlling pandemic. So it's very important to also use AI to help monitor for infodemiology. So what is an infodemic? So an infodemic is an overabundance of information, some accurate, but quite often some are not accurate. It makes it hard for people to find trustworthy sources and reliable guidance when they need it, which is very important in pandemic situation. So AI, again, can be used at monitoring or analyzing the big data. So here's one example, Twitter. So here's a study, recent study on misinformation. The researchers looked at 5 misinformation about being COVID just similar to a flu, or maybe the heat will kill the disease. Third one, home remedies. Fourth one, the origins of COVID-19. And fifth one, whether the vaccine has been found. So they use algorithms to track the Twitter, and you can see what are the misinformation that are being spread in the community. And by monitoring this, then you can come out with proper information to correct the misunderstanding by the society, by the people in the society. Okay. In my team, we also look at we can also look at so-called analyzing the social networks and identifying the nodes. Let's say the key influencer. Let's say if you want to spread or propagate the correct information, you can identify a subset of the people in the social network to help you propagate the right information rapidly to counter some of the spread of this misinformation. Okay, we are also, this is also my group, done my team, is to understand how people feel about the pandemic is very important for policy maker, right? So are people angry? Are people being hopeful? People disgusted? People are very afraid, fear? People happy about something? And people are being sad, surprised, and trust. These are the emotions that we want to detect. In this case, from the Twitter. It's an ongoing work, so you can see that actually, what are the if you want to figure out what are the primary so-called emotion that people are feeling about um, um, COVID-19, the pandemic. Actually, you can see sadness is one of the predominant um, um, so-called emotion of most people feel about the various topics. On the x-axis show the topics. Actually, trust, the green color, are the key emotion. Trust are also very important, which is correct because in pandemic, the trust of the about the topics are very all of the information is very important. So sadness and trust. Interestingly, angry is not very a lot. Actually, fear is also not that much. Actually, people feel more sad than afraid because I think there's still a good degree about trust, okay, of the various topics. So you can use this to measure or understand the emotion of the people in the society, the public emotion about the pandemic, and if you and then you can design policy or provide information to try to help mitigate the fear or other negative emotion of the people. So with all these examples on how AI has been used in helping us manage the current COVID-19 situation. So what is the answer to the question that we asked in the beginning? Can AI come and rescue us from COVID-19? So let me look at three things. Okay. So one of the things is that we must remember that if AI feed on data, yeah, especially deep learning. Why is deep learning successful? Why is deep learning? Why can deep learning beat the human being in a computer image, in a visual recognition task? Is because there was a lot of data for it to learn from, right? Hundreds and thousands of data. So no data currently, there will be no AI. So let me uh, revise one of the example I shown before. Remember, I show you one example of how AI was used to mine the electronic health records of people, right? 3,000 health records, and we can predict. Uh, the algorithm can predict the rate of mortality with very high accuracy. 90% is very good. I think maybe even doctor cannot do that, right? So so you think this is a lot of data, but if you look very carefully, right, at the way the research is being worked, for 3,000, actually after data cleaning, a lot of data are not usable. At the end, actually, only 375 data are 75 patients are being used for the machine to learn, okay, to whether um, a patient will survive or die, right? Only less than 400, okay. And in fact, the results of 90% was based on 29 patients, okay. So so that is very worrying because I don't think any of us should trust uh, the decision made by a computer based on actually only 375 and tested on less than 30 patients. So, but in the pandemic situation, it's very natural because data are always, by definition, limited because of the suddenness of the pandemic. So it's very hard to collect, and sometimes, uh, in the good sense, the data, not many people are infected, so you don't have a lot of this data. So that is one challenge. AI needs a lot of data. So here's one limitation of AI in the case of pandemic. Okay. So the other case is that AI learns from past data. So the past data must inform the future. Yeah. Um, if the past historical data is not very relevant for the future or even for the present, then it's not very useful. Again, in a pandemic case, it is very dynamic. Yeah? The past actually may not be applicable in the pandemic. Yeah. So one example is about, let's say, shopping behavior, right? So if you use the past data to predict how much people need toilet paper, right? You never know that actually a lot of people will go and buy toilet paper, right? Because there's no previous cases that can tell you toilet paper will be in a high demand. And then after that, actually, it's based on fear and a lot of misinformation, and after that, it goes down. So these are very unique cases. And if an algorithm depend on having a lot of past data, having a very stable history to predict the future, then it doesn't work very well. Same for the virus, right? The virus actually is mutating. So the model or the algorithm must take into consideration change. Yeah. But most of the AI algorithms do not take change into consideration. You just assume that the past can predict the future. So it's not very applicable. Yeah. So this is a second limitation of AI. And the third limitation of AI in the case of pandemic is diversity. Okay, so people are very different. So in this case, you can see not just the virus are changing geographically, but the model, the disease model, let's say in China, unlikely to be useful for the disease model in North America. The model learned by the data in North America may not be useful for people in South America because people are different. And also the context, the social context of the countries are all different. So there's big diversity. So this transfer of AI knowledge is also very hard. So not just you have limited data, but it's hard to be reused, okay, for across geographical boundaries. Even on the data perspective. So if you look at the language, so if you have AI language to monitor the Twitter, okay, actually you can look at it if you want to understand the South America, probably Spanish. In fact, quite a lot of them. Interestingly, Thai language also is very important in Twitter, but not all of these languages have a good machine AI model to understand the Twitter information very well. Or, for example, if we want to analyze the, let's say, medical records, medical notes also can be in different languages, and the diversity of human languages are also a big challenge. So, our dreams are shattered. In fact, this is what the verdict most people have come up with. I think AI couldn't really save us from COVID-19, okay? But maybe in the next pandemic. But really, at this point in time, there's a lot of things that AI needs to improve on before it can help us address the many challenges of pandemic, which I explained in the 3 points above. So, but let us take a look at what we do have now, right? We do have big data. Okay, of course, in pandemic, the data is a little bit small, but there are good cases, right? For example, the early warning from the big data. These are the part that they are useful. Okay, but the data, and then we have methods that can process big data very well. So these are the algorithm and the GPUs, the horsepowers, the GPUs, and then the smartness, such as the engine for the intelligence. But what else do we need in order to be able to fight, for AI to help us fight the pandemic? Yeah, I think there are 3 parts, right? One is actually we do need, although we have a lot of big data, we need more data. In what aspects? In the clinical aspects, actually, for some of you who try to use the clinical data, current clinical data to analyze, you will find out that actually the data collection is not well integrated into the current clinical workflow. There are many, many different formats. Hospital has different databases, and so just trying to connect all the data is a big task, and you don't have so much time to do that in a pandemic. So for future, to prepare for future pandemics, we need to have seamless and scalable data infrastructure built into the clinical workflow so that with one click of button, you want to get the data, it's very easy to get all the data in a standard format across all hospitals. To do this, you need to have good clinical data sharing standards as well as proper data governance, because clinical data has a lot of patient privacy concerns. So we need to address a lot of this, because not just the format, but also privacy concerns are the roadblocks for us to access the data to generate intelligence in the computer to help us combat the pandemic. So more data, that's number one. Number two, although we have deep learning and GPU kind of algorithms, we still need a lot of better algorithms. What kind of better algorithms? More intelligent and robust, in particular, less data hungry machine learning algorithms. And other types of algorithms, such as algorithms that can reason, right? That can do what if scenarios that doesn't need history to past data to predict the future. This means it needs to know reasoning, logical reasoning, and a lot of other, not just basically pure statistical approach based on data, which is data hungry. So algorithms wise, the AI researchers needs to improve further. The other aspect of it is we also need to start looking at the clinical assessment of effectiveness and safety of the algorithms, of using the AI algorithms. So, for example, in the example about the prediction of the mortality rate, although it was claimed that it was based on 3,000 data set, but it is very important to have a good workflow and assessment, standard assessment principle, framework to evaluate all these algorithms to make sure that they are safe. Because actually, if you look underneath, it's not 3,000 data. Actually, 3,000 is also not enough, but only 200, about less than 300, 250 was being trained and tested on very few patients. These are not very safe to use. So it's very important, because we tend to believe that if it's based on big data, it is very safe. But we have to look at that, and sometimes the data are also biased, and a lot of other issues to address. So better algorithms, more robust, more intelligent, less data hungry. So these are the two. But the third one about pandemic is about collaborations. Okay, we need two types of collaboration. One is multidisciplinary collaboration, because AI is by the computer science people, but then you also need to know a lot about healthcare, or the healthcare practitioner also need to know a lot about AI. So I mean the usefulness of AI and the danger of AI. Same for computer science, we need to know about the seriousness of our algorithms when it's being used on real people in the healthcare settings. So these are very important. So a very, very close interdisciplinary research between the clinical side and also between the engineering and computer science folks are very important for fighting against future pandemics. And open science sharing, as well as international cooperation, learning from various countries, and all these are very important, especially in pandemic case. So we need to set up some good collaboration networks and also framework for collaboration in terms of algorithms or even in terms of data. These are things we need to start building now in order to prepare ourselves for the next pandemic, which are likely to happen. So towards the potential issues, we need good data. Okay, let me click on it. Algorithms as well as collaborations. AI cannot help us at the moment for COVID-19. We continue to try, but we need to prepare for the next pandemic in these three aspects. Okay, with that, I end my talk. This is my lab. Okay, Innovation 4.0 at NUS. You can see one of the application of AI here. This is autonomous bus that is driving people from across the campus to come to our lab. Okay, I hope to see some of you here. Visit us in future, and perhaps we can work together on fighting the future pandemic. Thank you very much.
All right. Thank you very much, Professor Dr. Prof.See-Kiong. So we have actually 3 questions. I'm going to start with the first question, which is, who will take a responsibility if AI misinterprets the results?
Yes, that is a very good question. Yeah. So this question needs to be answered properly. So there's no, I have my answer, but there is no official answer at this moment. So as I mentioned before, we need to set up a good framework about assessing the use of AI in healthcare setting. To answer questions such as who is responsible, is the person who create the algorithms like me, okay, be responsible, or is the person who provide the data, or the person who use it, right? So so I will give you my answer, okay, what I think, but my answer is not the so-called official answer. My answer is since I'm an AI person, I know what all the limitation of AI. It is very dangerous to let AI make the decision on its own. Yeah. So in cases of disease, I think it is very important for human doctor to be the final final call. Yeah. The AI should be an assistant. Yeah. The best it can be is like a nurse helping the doctor. Yeah. But eventually the decision should be made by the doctor. AI can be a productivity tool. It can help to screen a lot of these data as much as quickly as possible. But I feel that at the moment the technology should be taking a assistant position. The human should always be in charge. Okay. But of course, there might be situation where the AI may need to make a decision. So, for example, in this picture here, the autonomous vehicle. This is a very famous example. So if the vehicle should knock down somebody, who is responsible? I don't have a good answer to that. Actually, this goes into interdisciplinary research. In fact, I have another project that I work with a legal professor, as well as public policy, ethics people, maybe even from philosophy, to look at this. So it's not a technical question, but it's a social plus technological questions. There's no good answer now, but my advice is that don't trust AI so much that let AI make the decision. You should still trust human being and use AI as a productivity tool.
Okay.
I hope that answers the questions somewhat.
I think it's a very good answer. I actually have the same opinion as well. I think like humans should make the final decide, to be the last to decide, right?
Yeah. So a lot of problems that are worried that people are worried about AI taking away the jobs of a human being. But I think human being, in terms of this ethical, moral situation, human beings should still play a big role, because after all, these are human values. So only human beings can defend and protect these values. So what's good about the computer is that it can automate, it can scale, it can do all the so-called low-level things very well. It can look at pixels. Human beings don't want to look at image pixels, but you can look at pixels very well. But for more important decisions like life and death, I think this should be made by human beings.
So I think we're going to move on to the second question. And the question is, we know that the AI has been used for treating HIV. So what would be the difference between using AI for the HIV and using the AI for the COVID-19?
Okay. Well, one of the difference will okay. Fundamentally, there's no difference, but I mean, in terms of the so-called confidence of the result, the algorithms of AI. The HIV, actually, I'm not familiar with the HIV work, but as you know, HIV is a much longer disease, much more well studied. There are much more data to learn from, whereas the COVID-19 is only very very new, right? We only have a few months of data. We still don't have enough information. So if you look at the quality of the algorithms from the perspective of the data that it has seen, HIV algorithms has seen much more data, right? Than the COVID data, right? But of course, the usual things, question about the ethics and all this still apply. Whether if the AI algorithm should still make a mistake, who is responsible, and all this. These are more fundamental questions that apply across the use of AI for healthcare, or any application that will affect the life and death or well-being of other human beings. I hope that answers some of the question. I am not very familiar with the HIV work, but I can answer. I mean, based on I think the so-called the amount of data that is different between these two situations.
Well, thank you so much for your answer. So next question. You mentioned that AI was used to look at the molecular structure to predict the drug usage for COVID-19.
Mm-hmm.
How about the chemical reaction? Should it be a main factor to consider as well?
Yes, actually, a lot of these. Yes. Okay, I don't know what you mean by chemical reaction, but the key thing will be to look at whether a drug molecule fit into the shape of the. Okay, there are a few steps, right? So first, you want to know the various type of proteins created by the virus. Okay, then you may out of this one you can infer quite reliably from the genome sequence, from the DNA sequence of the virus. Okay, although of course the virus may mutate or there might be errors in the code also that is experimentally determined, but those are a bit minor. Okay, so you can determine a set of proteins that might be generated by the virus. Then the next question you need to ask is which of these proteins are important to kill the virus, let's say, right? To stop the activity or reproduction of the virus and so the biological activities of the virus. So this is what we call function determination, right? What is the function of the proteins? Now, I mean, okay, the virus make protein A to Z, but what do they do? I mean, is this protein important? What is the biological function of this protein? So functional prediction can also be done with bioinformatics or AI. But again, all these are prediction. As with all prediction, there is always a probability that is wrong. Okay, it's very hard to come out with 100% accuracy. But then on the other hand, it can narrow down the experiment. Okay, so if it's predicted to say, oh, this virus, this protein is lethal, so you can out of the, let's say, 100 or 1,000 proteins, you can narrow down a few proteins to look at. Okay, and hopefully the algorithm is right. But you still need experimental validation. Like what I said before, you always need a human being. In this case, you need the experiment to validate, right? Thirdly, the proteins, the function. Once you know the function and you say, okay, now this is an important function, a protein to target. Now, which part of the protein to target, right? Because if you're using drug, it's a small molecule. A protein is a large molecule. So which part, right? So this you need to know the 3D structure because the protein behave in the real world as a 3D shape. Is not a 2D sequence. Okay. So again, like I said before, the 3D structure is very hard to do the prediction, to do the experimental determination. So we can look at other examples of how a protein molecule fall based on the protein sequence, right? There are many other proteins that are studied before. We can use machine learning methods to use it to predict. Okay. Okay. So these again, the prediction of the protein can still be wrong. Again, need experimental validation. But when in times of emergency, we can try to use them first while we wait for experimental validation, right? Then the chemical reaction comes when the molecules, you predict the molecules will bind to the target. And then hopefully by binding to the target, it will stop the function of the protein. And hopefully the biological function is important in stopping the biological activities of the virus. And then it stops the spread of the virus in the human host. Okay, so as you can see, there are many steps, and every step you can go wrong. Yeah, so it's a very complex one. That's why all this vaccine and drug takes a long time to develop. And then in the end, you need to test it in the human or in the animal, in the animal population, the live organism, and after that, test it in the human settings. Yeah, but what the AI can do is to help narrow down, remove away a lot of hypotheses that are unnecessary. Okay, and if your algorithm is good enough, it really help point to the right direction, that we can focus on our limited resource and our limited time to test the right molecule, to test the right so-called the right treatment. Yeah, but eventually the testing has to be done in vitro and eventually in the human being testing. So that's why we still don't have, although we can predict all the drugs, we can predict all the structures, it still takes some time to develop the vaccine, but or find some drug. But but all this, you start to hear some positive news, and all these are thanks to the data that are available and the algorithms that are being used to narrow down some of these possible solutions to the pandemic. I hope that answers a long question, long answer to a short questions. But I thought it's very important that we know that it is still a long way to go. There are many steps when we are dealing with biological system. It's just that when Professor Sauragi is talking about cyber physical world, when you talk about real world, there are a lot of complexity. So biology is also another complex world. We are starting to have some insight into it. We are starting to have some algorithms, but it's still a long way. Hopefully, by the time the next pandemic comes, we are much better prepared. Okay, but as you can see in the current pandemic, we are already using some of this technology. Okay, I think in the image screening, even the non-AI things such as e-commerce. Okay, in fact, this virtual conference. Okay, by information technology, right? Without all this information technology, this conference would not have happened if we have to do it in a physical way. So I think in the next pandemic, we'll see more contribution by AI or digital technology in helping us fight the pandemic better.
Thank you. Actually, we have a couple more questions.
Okay.
Okay. This question comes from directly from the audience. Professor Vilat Son Lerth Lambanit, do you want to ask the question personally? We will unmute you right now.
Can I talk?
Yes.
Thank you so much. Yeah, I wonder that if we could return back to the day of the beginning of the COVID-19, by today research, how do you think that we can find any solution to prevent the pandemic of the COVID-19?
Okay. Well, a few things, right? So one is early warning. So as you can see, actually, it's already possible, right? So in one of my example, the blue dot of some company was able to analyze the so-called the big data, such as news reports, other hospital cases, and so on and so forth, to have early warnings um, that a pandemic is coming. Yeah, so that's one. But my caution is, like you said, if we turn back the clock, hindsight is always perfect. Okay, so the problem with that is that if you look at the I mean all these early warnings, for one correct early warnings, there are probably 10,000 false early warnings, right? So the question then is, yeah, how, I mean, if your method it has a lot of false positive, people cannot take it seriously. But if you turn back the clock, the hindsight is always um, um, so-called you know perfect, right? So you must bear that in mind. Now, if I were to do this again, like I said, my early work is in bioinformatics. Okay, my dream is to use computer science or AI to find cure for diseases. Yeah, to understand disease and then to find cure for diseases. Um, uh, so if I turn back the clock, if I know some pandemic is going to happen, then actually you will know the virus mutate, right? So the SARS virus also come from the same root. So somebody, I mean, so we would probably study quite a lot on this. I mean, you can probably predict how the virus might mutate and turn into to a new virus strain, and then at the same time be prepared and collect all the data to analyze the potential structure and target and so on and so forth, right? But these are wishful thinking because at the end of the day, it is still needs experiment. Unfortunately, currently the wet experiment, the biological experiment, still doesn't move fast enough. So the cure, although AI, the computer can work on it very fast, but the cure doesn't come fast enough because you still need the wet uh, experiments. Uh, but the other thing I would do differently is what I said before, data, right? I think this can be done. So the problem that I have now when the government or other people ask me to say, okay, you are AI professor, can you help analyze the data and predict, like examples like what I showed before, the mortality rate and all this. What I found is that it's very hard to get the data. Yeah, the data is not in a readily usable way for machine learning. Yeah, so so what I would have done differently is that I will work on the digitization state of the hospital and also the data standards where it's easy to get the data. Yeah, that is step number one that we need to do before we run. Right, the algorithm is running or flying, but if we can't get the data, the algorithm cannot fly at all. So currently, I think most of the country and most people, especially in the hospital setting, the data are still silo and it's very hard to get it. Okay, whereas in pandemic, you need to get it very quickly. So I would have done differently is I would have pushed much harder in the effort of integrating the data into the clinical work stream and making it very easily obtained and integrated when we need to consolidate all the data in order to build AI algorithms to come up with more trustable insight. Yeah, so actually my answer is that you can't, at the state of the technology now, I think uh, um, AI can help, but it will not be the main saver. I think you will still need to depend on our human intelligence in 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 so-called outsmarting the COVID-19 virus at this point.
Yeah, I agree. Thank you very much. And I think that the Saraki Sensei, the first speaker, has mentioned about the super smart society. From your viewpoint, that you mentioned that if we can have an early warning, then we may be able to avoid pandemic or stop the pandemic. Yeah, so we have to be up to the stage of the super smart society that have data well prepared and a very good algorithm to do the prediction and make decisions. How can when on what moment that we should announce the pandemic? We don't have to be suffering about this kind of social distancing that what destroying the economic system.
Correct.
How do you feel about that?
Correct. But I think I mean the right. I mean the path to go really is digitization. Okay. So it may not be about curing the disease. As I said, AI or data or computer are already helping us. So you talk about destroying the economy, right? So if we do not have good internet, if we do not have e-commerce, good so-called data-driven platform for delivery and I think the economy would have died. I mean, all this social distancing would not have been possible at all, and all of us would get disease, right? So we should look beyond just AI to cure the disease, but also probably what also Professor Saragi talking about a super smart society for economy and other sustainable way to help the livelihood, not just to kill viruses, but also help livelihood, right? So already we are benefiting from some of these now. That's why it's a little bit more manageable still, right? So I mean the okay. I don't want to say anything bad, but I mean the economy has not crashed, right? It seems to be doing okay despite all this drastic thing. I think it's because the IT infrastructure is still holding on, and the society has moved with the help of the technology in other ways, but maybe not to kill the virus, but to maintain the economy and maintain interaction in the cyberspace.
Thank you.
All right. Before moving on to the announcement of the Best Paper Awards, we actually have one last question for you, Professor Eng-See-Kiong. So this question is, could you share your opinion towards the use of data in research, especially the limited access to data?
Okay. I think my answer is very obvious. Data should be open, right? But of course, we need to be mindful about privacy and other confidentiality issue. So what my current opinion is that the question is very good because you asked about research. So a lot of this data privacy consideration did not put the research did not consider research. Okay, it's more about if you publish share the data for commercial use or share the data in public, and most people can access it and so on and so forth. So I think we can look at it as a research as another separate use case where perhaps the researchers should be allowed to have access to more data. Because in the research community we have very strict ethics, right? I think most of us, if we handle human data, we need to go through IRB. So these are international standards to make sure we don't do anything bad, right? We also have confidentiality agreement and so on and so forth. So the protection of the data and also the usage of the data, I personally feel that the research needs to be considered as a separate case when the policies are being implemented as compared to commercial use of data or even public sharing of data. I think research, because ultimately research is to create new knowledge, and then research also have good data protection framework compared to commercial world and other use cases. So my feeling is that one should consider the research use case separately, and data should be more open to the researchers' use.